This patient was referred to me for endodontic treatment of tooth number 19. You can see large decay into the pulp, and you can see a periapical lucency here. All right. Looks like some furcation involvement as well. So here's the tooth. DO decay, distal occlusal decay, and you can see small buccal parielis and sinus tract associated with the tooth also. Right there. So we discussed options with the patient. The patient wanted to try to save the tooth, and that's what we did today. So looking at this PA, how many canals do you expect this tooth to have? Maybe two mesial canals, mesiobuccal, mesiolingual, and one distal canal. All right, let's see. So first off, of course, remove the decay, rebuild that wall, okay, that distal wall. That's the first thing that we do. And then take a look here. Okay. So that's one angulation. Of course, it's not a good angulation, but you can see here what I'm talking about. We cleaned out the decay first and rebuilt that distal wall. I used composite here. I use flowable composite, self-bonding. All right, let's open the tooth up. Let's open the tooth up a little bit more. All right. Take a look here. This tooth had 6 canals. 6. 3 mesials, as you can see. Look at all of that anastomosis between the mesial canals. Look at all that anatomy in the apical area. Okay, now let me show you so 3 mesials, you can clearly see them. Let me show you now the 3 distal canals. And here it is. 1, 2, 3. 1, 2, 3. 3 mesial canals and 3 distal canals. So if you go in with the assumption that this tooth has 3 canals, you'll find 3 canals. If you go in with the assumption that this tooth has 4 canals, you'll find 4 canals. And then you stop and you say, okay, I found them. But if you go with the assumption that this tooth has 100 canals, then you find them. You find them. And always remember, the middle mesial, you need to trough. You need to trough for the middle mesial canal. Trough for the middle mesial canal. Middle mesial canal of the lower molar is equivalent to the MB2 of the upper molar. So they're there. You need to find them. So overall, 6 canal systems. We did this, of course, in one appointment, despite the fact that there was a buccal parielis and sinus tract associated with the tooth. The canals were dry before obturation. We checked that with sterile paper point taken to working length. Everything worked out beautifully, as you can see. 6% sodium hypochlorite, sonic and ultrasonic activation, and then warm vertical obturation with AH+ sealer. We temporize the tooth and refer the patient back to our dentist.